It is 6:14, 1320 WILS. We're in the mid-60s now on this Tuesday. Not bad. Getting dead. It's going to be nice and chilly in the evenings at least. Crack the window open and enjoy the fresh air. This new study looking at early-stage breast cancer, finding that for many women, they can just simply skip chemotherapy without hurting their odds of beating the disease. Dr. Russell Skinner is an expert at this. He's also an expert in genetic testing, which is another part of the equation here. Dr. Skinner, thank you for joining us.
Thank you for having me.
Yeah, and you deal with what kinds of diseases do you deal with yourself?
I'm a family physician by training, so I treat a little bit of everything in a primary care setting.
Gotcha. And in terms of cancer, well, what do you make of this report? How did it strike you?
It actually is very, very much breakthrough. The study itself looking at whether or not certain groups of women who are diagnosed with breast cancer can forgo chemotherapy, in any patient population, but in particular the patients that I treat. Mm-hmm. That's tremendous.
Now, is it a shock? Is it a shock, or is it something you suspected for a while yourself?
Well, the study itself is a follow-up on a previous where they were looking retrospectively at whether at patients and how they did, and then what was the actual DNA or the actual genetic markers for their particular tumor. Mm-hmm. This test actually looks going forward. If I know now the genetics of your particular tumor tissue, how can I expect you to do? And so it actually is even has a greater impact in decision making because now they've looked going forward. They put those people into groups to get chemo or not get chemo based on those scores, and then 5 years down the road, sure enough, it pans out that those that didn't need it.
Okay, so are you saying as a doctor now you're comfortable after giving this gene activity test to not give chemo to a woman?
If they fall into that category. And, of course, the test looks at their recurrence score. In the study in particular was people that scored less than 10 on their recurrence score did not need chemotherapy. And, for me, if I'm talking to my patient, it's a big difference to say we've looked back and it seems that patients who had this lowest score probably didn't need chemo.
Okay.
That's a bit versus saying with this score, I can tell you don't need it. That's a big difference.
Do you leave that up to them, or what do you do with the chemo then?
No, I would think based on this score that becomes the new standard. We actually have now a good prospective study that says if your score is less than 10%,
you don't need it.
Benefits to chemo do not outweigh the risk.
So that means not losing the hair and going through all that?
Not going through all the side effects and cost and expense that goes along with chemotherapy.
Okay, so no chemo, so there's radiation, is that it, or?
What they would, and this group is looking at hormone receptor positive, so they would still use tamoxifen or one of the other aromatase inhibitors. So on the hormone side, they would still do those therapies that decrease that, so they don't have to worry about stimulating those receptors that could possibly lead to a recurrence, but being able to forego and skip the adjuvant chemotherapy.
Okay, so they're really getting treated for cancer would be essentially painless, or?
I don't know if I would go so far as say painless. They still obviously had to go through surgery in the first place, but as far as the ongoing need for chemotherapy, which can be, a lot of patients, it makes them sick, they have the hair loss, they don't feel well, and that's just the physical side of it. And then, of course, a lot of insurances don't cover those chemotherapies, or if they don't qualify for certain protocols and so on.
Really, insurances don't cover chemotherapy when you have cancer?
In some cases.
That's amazing.
So there can be some expense, and even if they do, there can be deductibles and so forth that have to be met. So it definitely is. It can be a cost to the patient, and in general terms, it's a cost to the healthcare system in general.
But what's the use of that?
Someone's paying for chemotherapy.
I mean, what's the use of insurance if you have cancer and they're not going to cover your chemotherapy? What are we talking about?
Right. And again, that every plan is different. So some cover those things.
Right.
If someone doesn't have insurance, it can be difficult to get coverage after that diagnosis is made. And so there is some cost associated with that, even if it is just a deductible. Some of the plans, it's a not covered medication. So it just depends on
the plan you're dealing with.
Particular plan.
The website is fhwplano.com. You do cryotherapy there too, is that right?
Yes, we do. We do the whole body cryotherapy. That's new. We've actually used that. We're using that quite a bit for an adjuvant treatment for our patients that are injured or have chronic inflammatory conditions, chronic pain, and so on.
That's where you freeze the body, basically?
You're in a chamber, and the body surface is cooled to about 32 degrees. The surrounding air temperature can get down to below negative 200 degrees.
Wow.
And it really does provide a lot of systemic anti-inflammatory effect.
Issues with joints, that kind of thing? Or
Yes, exactly. We even use it. A lot of athletes will come in. It actually shortens their recovery time between workouts. If someone comes in and they're doing they're a competitive athlete, for instance, they can come in after a workout, do cryotherapy, and recover overnight, as opposed to maybe taking a day before they can go back and do a hard workout again.
Have you ever gotten into the chamber yourself? Or?
Oh, absolutely. Yeah. I use it. I have my personal history. I have a bad disc in my low back, and it flares up from time to time, and I can get in and do cryotherapy about 3 days in a row, and I'm back feeling fine.
Just like that. And what does that feel like when you get in there?
It's cold, as you can imagine. It's cold, but it's not intolerable. The treatment itself only lasts about 3 minutes, and so it's a dry cold. And it's not like being out in a snowstorm. It's more like going into a cooler.
Really? So 3 minutes once a day for 3 days, and your back is fine. Just 3 minutes a day.
Yeah.
Okay, that's quick.
It really does make a huge difference, and of course it's safe to do daily. We have some patients that they like the way they feel. They're competitive athletes, and they can come in and do that treatment every day.
Yeah, if you get in a cold bathtub, does that mimic the feeling, or not even close?
It's not even close. One is that cold water, actually the sensation is that it is colder than the cold air that you're in that chamber. The other is that you do get more body temperature loss. Getting in that cold water where all that water is absorbing your body heat, as opposed to the cold air in the chamber, and so it's actually better tolerated.
Wow, it's
than the old school ice baths that we see people in.
Yeah, I want to try that on myself. It's Dr. Russell Skinner. FHWPlano.com is the website. He does it all. Dr. Skinner, thank you very much.
You're very welcome. Thank you for having me.